Okay, we one away from 20. So welcome to the couple of uh, participants that joined now recently. I just want to do some house rules quickly. Please keep your microphones muted during the session. We will give you the opportunity to question and answers after my presentation. Then we can talk about what is required um, and take it from there. So yes, the main thing is here that you do have something to drink, um, at least, and to sit relaxed and listen to what I do have to say and share with you the information that we experienced so long. We started with this whole, can I say, campaign or the assistance to businesses out there already since the beginning of March, where we started with webinars, alertness, awareness campaigns where we can try and help businesses, employers, small businesses in this pandemic we are facing. And it's not only South Africa or Africa. Disease is a worldwide disease. And we need to know who's the enemy. We don't know. That's the word. So, yeah. Um, I just want to let some people still coming in. Though I'm the host, I'm also the person at the door to say, welcome in. I will, as you come in, mute your speaker also. I can do it from my side, so don't worry. This is a recorded session, so we will have it available. I will send it to my host, and she can distribute wherever need be. Stella, so you can just take note of that. I will send it to you. I do have my assistant also with me, Mr. Dion Lowe. Dion is in Gauteng. I'm in the Western Cape, Cape Town. I'm in Joburg Strand, very near to the sea. It's really nice, but it's chilly quite here with us. So, yeah, I see our temperature this morning at this stage is 16 degrees. Might going so far as 22 for the day. Okay, so yeah, it's normal winter coming for our way here in Cape Town. I don't see any rain yet. I'm worried about the rain, but yes, then I'm worried about the coldness of this with the pandemic around us, because the pandemic loves um, the coldness. That's one thing. All right, I'm going to start, if that's right with you, Stella. From my
Yes, Charles, I think we should definitely get going.
whoever joins us, they can catch up and they can also ask us via email or something like that. They're more than welcome to do so. All right.
Sure. Thank you.
Pleasure. So I'm just going to take away the screen away and get into business. All right. Like I said in the beginning, there will be a Q&A, questions and answers after the session. So sit in tight there, write down what you want to know, what you want to discuss, anything that you can't remember or did not remember. Post us out an email. You're more than welcome to do so. I'm not afraid to answer emails. I love writing emails. That's one thing about me. I enjoy writing sometimes. So Dion knows me. He knows I'm writing. So yeah. But that's maybe why we're sitting in this room today. Welcome again to this COVID-19 presentation from us. Um, and it's a sad time to understand that this pandemic grows from the 9th of March to 102 countries worldwide. And that's why it became a pandemic. Now, the coronavirus disease 2019 is a disease that's caused by the SARS-CoV-2, a virus. To reduce the impact of COVID-19 outbreak conditions on business workers, customers, and the public, it is important for all employers to plan now, and maybe sometimes we're a bit late also on this, but to plan now about the COVID-19. The COVID-19 is a virus unknown to anybody. We don't know how long that virus is alive, where it is laying, whether it's in a public toilet, bathroom effect, where you want to wash your hands and you go in there innocent and you maybe got contaminated. This thing was, well, it's my presumption, and I see that the World Health Organization also was spread through traveling. So there was a lot of traveling people going overseas, having holidays, having business meetings. But I can tell you one thing, after this, South Africa, and not South Africa only, the world is going to change in terms of this virus. I just read this morning something about geared you up to sit with this virus or with this pandemic for about 2 years' time, and a change thereafter. So it's quite, for me, it's not comfortable, because we used to be hugging each other, and when there's a nice gathering together and to celebrate and to say thank you, you know, we expose and we show it by grabbing hands, by hugging and that kind of thing. And now we like, okay, good morning, how are you? That's the best way I can say good morning to people. You don't shake anymore or give a kiss or a hug. However, the virus is, the important thing about this virus is that we must remember one thing, that we must not stigmatize this whole thing to people. It is the similarity of HIV. It's a very sensitive issue. It's an issue that we really need to take care of when we call on a person to say, you know, I want to know, are you contaminated or were you in contact with a person? You have to do this very sensible, very sensitive, and that you do respect the other person's dignity as well. Not only your own protection, but also that person's protection. If you go and say, oh, I know Mr. X is contaminated, that's wrong. That's only a story. You're not a medical practitioner to make such an announcement, nor do I. Nobody do have the right to do that. And when it's a medical treatment on that person, they get confined separately in a space where they are alone and not getting stigmatized by other people's gossip. And we know what gossip can do to a business relationship, and also to your customers out there. And a lot of you are businessmen. A lot of you are in business, and that's the reason why you are here, is to listen to see how we can limit it, any risk to this whole pandemic. Now, COVID-19 is very important that we understand that there are certain policies, procedures that needs to be in place, especially with people, or may I say, businesses working with a lot of staff members, that you do know what you are facing, what you're dealing with, and that your employees do know also. And they must be conversant. Now, what is conversion? They must talk about this thing with knowledge, not to say I'm fear. There's a virus somewhere, and that's why we're wearing a mask. No, conversant is to say that I can talk about this with passion, that I know. I can warn you about it. Please, this is the kind of mask you must use. That is a sanitizer you must look at. Please sanitize your hands. Wash your hands. That's the rules, the basic rules that need to be there. But your employee must be equipped with that knowledge and with that passion to talk about it and not fear him and keep quiet. I don't know how to deal with this. That through that, there will be a chain reaction within your employee staff. Your whole staff will then talk to one another, share their compassion, share their problems, and share their fears. That's the best way to protect yourself. It's the best way to be in a workplace with a sound relationship between all, and not with fear. You don't want to manage with fear. You don't want to deal with fear. That is the thing. And we must not fear this pandemic at all. We must take it on We must listen to what health practitioners are telling us. And I must be honest with you, it is very good when your country, your government is involved here without limits. And we've seen this now, though we are very frustrated. You're sitting at home, you can't go out. Yes, only for essential services or essential goods. Yes, but do we really know who's the enemy out there? This is an enemy, the virus. We don't know the virus. We just heard now recently that it sprang up in the areas of Wuhan again. So is this virus coming back? Like TB is changing its futures. Then he's got hands and little things, and suddenly when there's a vaccine coming in and attacking him, he changed his whole pattern into a new pattern. So you need to go and get another vaccine to fight that pattern. That's TB. Now, is Corona the same thing? That's a question mark. We don't even know how long this virus stays alive on any form or platform or any place. That's why they're saying when you're using a, a, a towel, it must be a paper towel. The towel needs to be destroyed. That means it must be treated the same as medical waste. Now, medical waste, it will be dumped in there with gloves, closed down, and taken away, destroyed in fire. That is how severe this whole thing is. Now, let me go into another share I want to give you, and that is my presentation on today. And we call this compliance manual workshop. Now, the compliance, sorry for that one. I just want to get in here. There you are. Okay, once again, please jot down any information that you require. At the end of this presentation, there will be also more details of Stella, especially Stella. She's our host, and she's the organizer of this whole process. And I will appreciate if you can work through her at this stage. Introduction, the return to work started back now. We are allowed in level 4, we've got 5 levels. Level 5 was where everybody nearly was isolated at home. You close the business. If it's not essential services, you cannot go on operating anymore. So that was the lockdown. Then level 4 allowed about 30% of the staff to return to the business. And that is where there was given a template or guidelines from the government to say, you need to now start writing a policy. And we call this policy or this draft policy, which is you can adopt and, can I say, tailor cut it to your requirement of your business. Return back to work started back. It's a guideline along with certain pro formas, generic documents. That means the appointment of a safety officer or compliance officer, the minutes of a meeting, the health and safety meeting that you do have that you need to jot down in minutes, and that everybody that's there can sign, and the attendance register, there's an agenda, everything. To assist the implementation of the applicable regulations. Now, we had a lot of regulations in terms of our legislation in South Africa. The manual informed by is the Occupational Health and Safety Act. Now, Occupational Health and Safety Act is not only a South African thing, it's actually international standards that we adopted then. So it can be tailor-cut into your country. It is not limited only to South Africa. Disaster Management Act 57 of 2002, all countries will that have. And then now recently, there will be a disaster management regulation in each and every country to say, how are we tackling this pandemic? And then just a conclusion on the policy, it's a compulsory thing that you need to have this policy and procedures in place. And the reason why I'm saying it is compulsory, if you do not talk in writing to your employees and to your persons using your facility, how are they going to be aware and do have knowledge about what is your standards, what is your rules, your house rules, you can call it, in this whole process of pandemic? COVID-19, it's here, there's a company policy inclusive of a risk and hazard assessment guidelines, compulsory legislation, and an objective. The policy should be read in conjunction with your current occupational health and safety policy. Remember, health and safety policy are talking into this virus pandemic also. So it's very important that you apply all principles and disciplines of your current occupational health and safety policy. Provide and maintain, as far as reasonably practicable, a working environment that is safe and without risk to the health of your employees. Very important. It's not only your employees, but also your customers. They want to come back to your place and know your place is safe. And that you respect when there's a pandemic or anything like that, that you do have the necessary disciplines and process and protocols in place so you can avoid a disease going over. Okay, back to basics. Yes, it's going back to the World Health Organization's guidelines on reducing the infection and what to do with the symptoms. Now, the symptoms is a very, can I say, a very important thing. I just want to admit somebody else. It's the symptoms, how to deal with the symptoms, we don't know yet because we've never been there. I'm not a health practitioner. I am not a doctor or anything like that working out there with the patients, but I've seen and I've heard of people that I've been in contact with and talking about this whole pandemic and the virus. So we need to understand how to deal with it and how to identify. Now, there's certain, your thermometer is the first thing. You've got an infrared thermometer in that you can scan each and every person coming into your building, going out of the building, to limit the risk. Further, also do have the policy of masks. Now, with us here, businesses going into businesses, you cannot be allowed in the business without a mask on your face. That is, there's no point of debate. That's it. So you will definitely being blocked to say, sorry, you can't go in, go get yourself a mask. We cannot allow you in. That's our policy. Now, that's all the risk and the hazards assessments that you need to do on your business. If, for instance, you do have a supermarket, you do have a lot of feed coming in. Yes, and you need that feed to come in because you want to make business. You want to sell your goods and you want to make a good profit. Yes, but unfortunately, you are now barred from that, going so openly and just invite everybody to come. So I would say, really, put your measures in place. That is very important, that you do that according to that. Now, sorry, there's some more delegates coming in. The workplace controls, and I will go through the document now, which is the template that you can use, and you will see it's a thorough thing. We were complimented with this document by the Health and Safety Organization here in South Africa, which is also an international connected organization. So it is something that you can use. And you can adopt it, like I said, to your business needs. It is, first of all, the employer's responsibility to ensure a safe working place, a safe working place. And therefore, you need a safe working practice guidelines to employees and to visitors across the board. And then your PPE, it is your protection gear that you require for your place. Now, that protection gear are not so much, can I say, intense, like going into a theater, when I'm talking about theater, medical theater, where you need to have a whole suit and everything onto that. No, you need basically a mask so far. Wash your hands, enjoy the people standing at the door with sanitizer, sanitize your hands as you go out, and ensure that your family, your employees, and everybody is safe with that. In specifics on the matter of travel, meetings, and transgressions, on this stage, the in thing is obviously Zoom, Skype. WhatsApp is now also coming up to this, or stepping up to the public domain to say, yes, we can also now host about 50 people. And yeah, and stop traveling. You will save a lot of money. Instead of flying to America, flying to Europe for meetings, you can do it on Zoom. You can do it on there's Microsoft Teams, and there's also then Zoom, Skype that you can use. And as I mentioned, WhatsApp is also now there. Now, the policy, the risk and the hazards assessments. It is advised that the daily risk and the hazard assessment is done and that a written record of these analyses being kept. Now, in the whole policy and the frame structure of the manual, all these templates is in there and you can use it to your benefit. A representative should be appointed to ensure that the daily risk and hazard assessment is done. Also, looking after the staff that they are abide to the rules of the employer's workplace, of the place where they are going to work. For instance, you're a security company, a cleaning company, you are there to supply your services to other people, so your staff need to adopt the health and safety regulations of that client that your staff is going to work at. Important, remember that. And make sure that your staff do adhere to that. Appropriate risk analysis must be done at the premises, obviously, because that risk analysis will allow you to understand how to write your policy. By utilizing the risk and hazard assessment template, the representative shall provide a copy of all documented information to the employer or to the compliance officer. Remember, very, very important, the risk and hazard assessment can be found in the COVID-19 policy and return to the workplace. It's in our document that is already there. So you don't have to go and reinvent the whole wheel. The wheel is already there. Take it, build a car. And don't be afraid to do these things. Workplace plan. A structured employee facing in plan. That means when they're coming in. Remember, when you're working with a big operation, I had a question the other day. This guy is working, he's got his construction business. They are busy with the construction of about 14 floors of a building. And he said to me, if one of my guys is contaminated, what must I do? Must I shut down the whole entire operations? I said, no, you don't need to do that. You need to know where your employee were working. Where your employee with how many people in contact. Out of that, you can then assess and see what is your risk at that stage. But to shut down 14 floors and see who is contaminated or not, it's not going to work for you because financially you can be ruined through that. So phasing in plan is bringing people back. That's why on our level 4, they're only allowing 30% of the staff. And I'm not talking about places like your supermarket, like the Pick and Pays and the ShopRites and that kind of guys. They do have their staff already there. They do have their plans already in place because they are selling essential goods. We need to eat. We need to wash. So we need washing powder, we need soap. That is the importance of their services or reason why they are there. According to the COVID-19 direction on health and safety in the workplace issued by the ministers in terms of regulation 10.8 of the National Disaster Regulation and the regulation issued in terms of Section 722 of the Disaster Act. It's a must to have this plan in the workplace. Whether you are in any other country, it do not make a difference. This is a generic thing that you can use, and you don't have to use all these sections because that will not be there. You will use it what's appropriate to your country and to your area. The plan developed in a bid to facilitate the proper and effective application of your health and safety, of your rules. I'm calling it rules. Of the rules in terms of the virus, COVID-19. COVID-19 directions on health and safety in the workplace is issued by the minister, yes, but it's also issued by the World Health Organization. And there's a big website of World Health Organization that you can go and visit, and they're talking daily about this coronavirus. And it's important that you gain as much information as possible through that, because that will help you at the end of the day. Let's see the plan. There is a plan for small businesses. Now, when you do have less than 10 people, your plan of your rules and your disciplines will totally different from a company like, say, a big organization, Shoprite Checkers. It's a superstore. There's about 100 people working there. That's a different story, because the risk is higher there than at a small shop with 10 people or less, and there's no risk, or there's a limit to the risk. But we cannot say there is no risk, please, really. The plan also discusses a plan that can be basic and reflect to the size of the business. This is written all in conjunction with the requirements of a small business and a big business. Use the COVID-19 ready workplace plan. We provide and amend it according to your business needs, like I said in the beginning. Medium and large businesses, that is 10 plus. Now, according to our legislation in South Africa, if you are employing more than 10 people, you're in a higher risk. The less, the better, but you're still in a risk. A more detailed plan should be developed for organizations with more than 10 people, and use the COVID-19 ready plan. We provide it and amend according to your business needs again. We just admit another. The phase return to work plan. Now we're inviting the employees back to work. Steps to take to ready the workplace, the risk, the assessment, the health and safety, and the traveling disclosures. Clean and disinfected the workplace, very important. We must now remember, returning to the workplace with our staff, we must be sensitive in terms of the age of the people, the age of that staff members coming back to you. Any person older than 60 do have a lower immune system, and you're required to be sensitive on that. To talk to them, call them in camera. Now, if I mention in camera, it's not in front of a camera. It means in the privacy of your office. Talk to them and ask them, do they understand what this pandemic about, that they are vulnerable to the pandemic, that they can be infected with this pandemic, and why is the reason that you, as the employer, respect their age and want to protect them, and that they rather stay at home till it's such a level that they are feeling comfortable to come back to work. But it's not only to the aged people, it's also to people that been infected with TB before, as well as also with HIV. Now, most of the time you will not be having the knowledge whether this person was tested positive for HIV. you might be knowledgeable with the conditions of that person contaminated with TB. Now, it's not to say that the two are working together. TB is totally different. TB is a very general thing that happens. You can also be infected with them anywhere. So it's not to say that it's something new or it's something that's stigma to HIV. Remember, we must not stigmatize this whole pandemic. Okay, then listed the 60 plus work from home, or everybody. The World Health Organization, our country is calling on to please stay at home, wash your hands, sanitize, and only go out when needed. So it's very important that we understand that, and that we allow that everybody is trying to educate us in a better way forward. Arrangement, social distancing. It's about 1.5 meters to 2 meters. Now, the shops here do have some guards. They've got some strips where you can walk to and know that is your space that you may enter now. Please, that social distancing is very important. It is one of the most important things. And I had with one of my weaponaires earlier last week, a week before that, a very senior medical nurse or a sister that's working with people, and she said, and she told us that the effect of applying social distancing 100% will help a lot to your environment, to your organization as such. And that's why people, places like the gyms, the health gyms, and gathering places, churches, everybody said you don't open your doors. Unfortunately, you stay away from those gatherings. There must be special arrangement for funerals. They don't say, no, we're not going to bury people. Yes, we are burying the people, but we're only taking the real family and a small gathering of 50 people max to the funeral. And you will find that the police or the South African Defence Force will be at that funeral to look after the process and the proceedings. Sanitizing, 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 and screaming, sanitizing. Screening systems, yes, you've got on the stage and you've seen it. Actually given birth out of China, where there was looking like a gun in front of the person's head. It's an infrared temperature reader, thermometer, and please, it's about for 1,000 rand you can get a very good screening device. Make use of that. Rotation, and also cleaning of your places that you people that's going into your facility. That sanitizing is very important, not only on hands but also on surfaces. Also cleaning your computer, your desk. The moment you're a manager, you need to interview people, you need to have a one-on-one session. There's some nice shields available that you can put up in front of you that safeguard both parties, but you can have a good interaction. Welcome to all the participants. I enjoy seeing you coming in. And then what are you doing with your visitors? I've mentioned that already. Minutes of the meeting, employer's responsibility. There must be a minuted meeting. That means in writing, delegates in that meeting sign for it, and then your compliance officer must see that it will be affected out and being implemented by the rule of 100%. Employers' responsibilities. Use the provided documentation titled Detailed Employer Responsibilities that's in that framework of the manual to implement all applicable employer responsibilities in the workplace. This is very important that you document this whole thing properly to the needs of your business. Make use of the minutes of the meeting as provided to ensure effective compliance with the responsibilities as indicated. Okay, discuss with your employees the recommendation listed. We need to talk, because that's what when I started, I said to you, your employee must be conversant in the information about the virus. He or she must talk about the pandemic and how he or she are taking precautionary measures, safeguarding everybody around them from being contaminated. And that is very important. Remember, tonight you're going home, you're seeing your family. Before you enter your house, did I sanitize my hands? Where were I today? Am I okay to come into my family today? Did I do the precautionary measures that was put out there in my workplace? And that is the important thing about it, that we apply, because tonight you're going home, your employees is going home. We must be sensitive about this virus. At the start of a discussion, ensure that all employees sign the attendance register that needs to be in that meeting. It's not to say you must have all your employees there at one time. You can do it with departments, you can do it with a few delegates from each department, and they need to go and inform their departments. It all depends the size of your business. End of the meeting by declaring that the discussed policies and measures are now implemented with immediate effect. So they must take their hands up and say, we'll sign off here and say, we are going to see that it's implemented and the disciplines and the protocols are all applied. And I think we must talk about the sensitivity about when you go back to your family. Are you safe with them and they're safe with you? Okay, welcome to another one, another delegate. COVID-19, the ready checklist. That's also in the manual to ensure proper compliance with the workplace plan, policies and regulations. Compliance officer, appoint a compliance officer. You can call it a compliance manager, compliance officer, a person that can take authority, a person that takes responsibility, because this is a huge responsibility. Warrant letter, and then checklist for employers' responsibilities will assist you to ensure compliance with employer responsibilities in the workplace. You want to safeguard you from any lawsuits. You want to safeguard yourself from somebody claiming from you damages because of insensitivity that was not applied in your place. Now I'm contaminated. I'm suing you. It's my right to do so if I felt that there was negligence. But obviously the negligence needs to be proved to court. And that's a debate for another day. But anyway, remember yourself to safeguard you from unnecessary court orders, unnecessary court applications, because of you were not sensitive about the pandemic. Detailed inspection checklists to assess the potential risk of the exposure to COVID-19, control measures, and provide recommendations to management. The templates is in there, the PPE register, employee visitor history register report. Now there must be a register also for clients entering your shop. For instance, a small cell phone shop. I've been there, I think it was on Thursday, and I had to sign a register. And I was just checking the staff, and I asked him, why must I sign this register? I never did it before. And they said, sir, that's because of COVID-19. I said, thank you very much. I respect you for that. So remember, your visitors register must be there for people going in, coming out. It is impossible to do it for a supermarket or such. But a smaller shop, I would suggest that you do so. I would suggest that you do have, where you do have access control, that you include that, because obviously with your access control, you will have attendance register also for people entering, whether it's employees, visitors, or customers. Employee health disclosure document. Now, if I can stand in this point, your employee might say, sir, I'm feeling not very well today. I feel that I'm identifying something of this COVID-19. And I know you're going to freeze and say, what now? What must I do now? No. In South Africa, we do have a toll-free number that you can phone. They will ask certain questions to establish whether you are infected or that you do have a symptom or symptoms of the virus. The moment they identify that, they will tell you, please quarantine yourself. We are going to send out a team to test you. Now, once the person is quarantined, it's 14 days plus. It can go so far as 21 days. Now, that 14, 21 days, we have to use it as a special leave. Special leave is just to keep away the person from your workplace in order to avoid that this virus are spreading amongst the others, if there's a possibility. Now, once the person has been cleared, the medical practitioner or hospital or clinic who diagnose or do the prognosis must issue a letter to say the employee is fit for work. Because that is your guarantee not to be sued. Remember that. And you place it on that person's file for future reference. So it's very important that you understand that you apply these rules very, very strictly. It's only for your safety. I'm going to be honest with you. All right, and that is the end of this session. I'm going over now to the documents that I mentioned in this presentation. Please jot down the relevant email addresses if you require anything. And like I said, our beautiful host, Stella, she will help you, assist you, and with me, I will support her all the way. Where she needs help, where you need help, the two of us and my colleague, Mr. Dion Lowe, we will help you where as much we can do so. The templates are available. You can discuss it via email later with Stella or myself, but we will interact with one another in this. And we can then take it from there. So I hope you did take down the email address so far, so that, and contact numbers, there's mobile, there's fax numbers, there's landlines, everything available to you to contact Stella. I'm going over to some other documents I want to share with you, and that is the one I was referring to. And that is the manual, the starter pack. And I hope you all can see this. It's on Word, so I'm just going to run through it quickly. There's the index, the starter pack guidelines. There's a proper guidelines giving you everything that you need to adhere to, and reasons for that. Everything that I mentioned in my presentation, you will see now filtering out here, like the warrant letter for compliance officer appointment. There must be an appointment. I cannot just say, you are now today the compliance officer. But what must I do? I don't know. I don't even know what is a compliance officer. For what? It can be for anything. So remember, rules, regulations are very important. Detail employees' responsibilities and others. Index to guidelines, preparing the workplace, employer's responsibility, workplace rules and policies, implementing rules and policies. And this is a document for about, I think it's 60 pages. I just took out the summary of the whole thing. The whole total document is about 65 pages. That's excluding the policy as such. This is policy covering this manual also. Right, let's just look into, I think it's a broader one, this one. No, that's my summary one. Yes, okay. That is the policies and procedure in terms of your manual. Your policy is available also. And like I said, that is an umbrella thing to describe why there's a manual and why all these appointments and people are appointed um, to the whole process. So yes, I think, Stella, I want to go over to question and answers. If the delegates wants to do some questioning for answers, they're welcome. You can just unmute yourself and then ask your question, and I will respond to it as far as possible.
Thank you very much, Charles. Thank you for such an informative session. Thank you everyone who has made time to be present to this meeting. Just want to highlight what Charles said. The documents that we will send to you after include the compliance and return to work manual, also a COVID-19 policy, a detailed employer responsibilities, which is a checklist, and lastly, a risk assessment form. So please just bear in mind that we've got all those documents available for you. So at the end of the session, just ensure that I've got your email addresses so that I could email them to you. Also, lastly, please note that the session has been recorded. So if you would like me to share with you a copy of that, also do let me know. Thank you very much. And you're now welcome to the question and answer session. If you have any question, please do let me know. Charles, one of our participants, Fiona Musana, who unfortunately I think has left us or is still here, I think she's left. She left us with a question, and she wanted to know how do we navigate plans within the realm of social media? That is, how do we ensure everyone is speaking off the same page? I think what she means is with the social media, with information going wild all over, how do we ensure that we've got uniform information? A very critical question, I think. If you could just shed some light on that while other participants prepare their questions. Thank you, Charles.
Indeed, thank you, Stella. Yeah, that's a very good question. We must understand that there's a platform, and that is social media, and social media can confuse you or help you. So it's like me going to Google something. There's a lot of things about Google and to say about and express about Google, and you might find the answer or a very confusing answer. So I would not rely on things like Facebook and any other information unless it comes from the World Health Organization or from your government. In such, you do have a very good media platform which are interacting with the government on a daily basis. And I would rather believe onto them and then making up some news coming out of social media. And we must be really critical about social media because it can creating a well, not a pandemic, but it can create a lot of confusion. So it is for you and your principles or your training and awareness time that you come across and give the right information. And where did you get your information from? I'm relying totally on legislation. I'm relying totally on what is said from the World Health Organization, our country organization of health, disaster management. I'm only listening to them, and I'm only applying their rules to it. So that is the importance of avoiding social media, especially Facebook. I don't like Facebook very much. Yes, it's a very good advertising tool, but the gossip can be severe. I hope that answers more or less the question there, Stella.
Also, I think it does. We also have Mponeng. Mponeng also says she has to drop off. I'm not sure if she has dropped off already. But her question is, she wanted to know if she is renting in a building, where does her responsibilities start and end in terms of guidelines of entrance to the building and safety measures?
Okay, she did not give me a lot of specifications about this building, because the building can utilize or accommodate more people for more offices or more shops. First of all, if the building don't belongs to you and you are in an office block in that building, the responsibilities of yours start from the door that enters into your space. You have to interact with the landlord or the owners of that building to see what precautionary measures they are putting into place. Because you can't be held a liability to the whole building as you're only in one part of the section of the building. But that section of the building, your responsibility starts from there, in conjunction with the owner of the building. That means in terms of the landlord or the owners of the building. That is how I see where she is coming from, Stella, if that's okay.
Okay. Thank you, Charles. We also have, I'm not sure who this is, from an iPhone. He or she would like to know the differentiation of occupational health and safety and risk policies plus personnel, where to get good infrared thermometers, and also where to get good infrared thermometers.
I just received this morning 2 emails from companies. I don't know where the participant is situated. Is he in South Africa? In South Africa, I can refer you easy to people, and also they will with ease make their product also available to foreign countries. So it's not limited. So if you want to, I can give you the information. If you drop me maybe your email address, I can jot it down. I see it's from iPhone, the participants whose screen name is iPhone. Drop me your email address. I will drop those emails to you and you can investigate that. I've got 2 very good companies that can help you. I think you're talking about this infrared thermometer at about going now at 1,000 Rand. Yesterday we were still going at 1,299, and I know about 999. Also good product.
And the difference between OHS, occupational health and safety, and risk policies.
Okay, that's the same thing. Occupational health and safety and risk is the same thing. Risk do have a divert into risk in terms of driving and that kind of things, with more damage done to vehicles and yourself and your employees. But when it comes to health and safety, that also applies. Your risk in terms of health and safety. Important how you govern these 2 together, because a risk falls under health and safety.
Thank you, Charles. Any other questions? You can just unmute your mic and send through your questions, please. Thank you.
So the participant for iPhone is in Randburg. If he or she can just send me their email address, I will send them the information and they will deliver it to your door. It's not my company. I don't owe them. I don't know them. I just receive the information because it comes from other sources which I'm in connection with.
Good afternoon.
Good afternoon. Good morning.
Afternoon, Charles. Good morning.
Hello.
So on our side, our structure is that we have over 100 employees, but most of them are contractors at client sites. And in the office, we only have about 7 staff members. Now, in terms of drafting all these policies, do we follow guidelines in terms of a small business with less than 10 employees? or would we have to have policies that take everybody into account, even though they never come to the office, and most of the time they're client sites and they're following client policies and rules?
Excellent. Good question. Yes, indeed. You need still to have the policy as a framework. But then remember, now you're talking similarity to something like a cleaning company or a security company where they're working on sites of your clients, you understand? So I'm just taking an example. I don't know in what business market you are in. However, the moment you post them or place them into a client, one of your clients' sites, your staff needs to adopt that specific health and safety rules and regulations of your client. Now, before you entering with your staff in there, make sure that you ask the question to your client whether they do have this kind of policy and procedures within their place and what it is, so that you also can train your staff with it. And then your staff again will sign that they were trained accordingly and they will adopt and adhere to these rules and regulations. Did I help you a little bit there, Yulisa?
Yes, it does help. Well, our industry, just to answer your question, our industry is in IT. So we have IT specialists who work at client sites.
Yeah, no, the same year, the moment that person enters that client's premises, they need to adhere to that client's policies and procedures. The office staff that you do have, which is very minimal, you can apply maybe to your 10, but now I do have a problem. One of my clients is a security company, quite a big security company, and they do have managers. Now the managers are working away from the office, they're more operational. So one of the managers was tested positive with corona. And they phoned me up and they say, what now? And I said, well, see that your manager is immediately placed in quarantine, phone the helpline and get him sorted out. Ask him where he was before he was contaminated, so that you can put alert, not to say the manager was affected, to say, if you do have any symptoms that you identify, please inform the office. So that's part and parcel of your manual that you are going to write and that you're going to give it to your employees so they understand what's the seriousness of this whole thing. So in terms of that small office of yours, say one of your IT guys comes in there, what are you going to do? What is the precautionary measures you're going to put in place? That's the question. And only you will know, you know, how the layout of your operations, of your office, that can answer to that. But yes, I would, for a very good precautionary measure, rather put in place this document, this manual to everybody. And in that manual, you say, you must remember when you enter the client's premises, you adhere to their principles of health and safety and the risk.
Yeah, I think it's clear. Yeah, that's clear. Thank you very much.
Okay, thank you for your question.
Thank you, Alyssa. Charles, we have one question here from Nelson. Nelson Bassol. Nelson wanted to know, when the employee is placed on special leave for a long time, who carries the cost? The employer or COIDA? I think that's the compensation for occupational injuries and diseases, COIDA. Who
Indeed.
Carries the, yes.
Yes, indeed. You're quite right, Stella. Excellent. It's COIDA, that is for the medical expenses, but on the other hand, there's something like that on the UIF for ill benefits. So at least this person can still earn a living. So the moment a person is being diagnosed with any illness, and being placed on sick leave, more than 14 days, consecutive 14 days, the employer may place that person on the UIF for ill benefits. Remember that. It's not only for maternity, it's not only for a huge medical thing that the person go on UIF or for unemployment, but it's also for a period of 14 days plus where the employee was diagnosed and placed on sick leave.
Thank you, Charles. Nelson, I hope that answers your question. Okay, great, thank you. I saw you nodding. So I also have a question here from the iPhone user from Randburg. iPhone user, kindly just give us your name so that we don't refer you to as an iPhone user. Your question, I think it's two different questions in one. He says, how do we apply this for a training company that is a suitcase provider, where most of the time we move around to a particular venue? How to ensure compliance, or must we do screening of learners only at a rented training venue, or everyone, or they must do it as a package? Who is liable? So it's two things. Do they do the screening at the rented venue only? And if they're coming to your venue, you don't do the screening. And secondly, if they're doing the screening at the rented venue, who is liable for the cost of the screening?
Okay, I see Dion just now comment also on that. He said, let me try to answer this question from the iPhone person. The new risk policy and manual is drafted in terms of the regulations, in terms of the Disaster Management Act. It is complementary to the Occupational Health and Safety policies and in terms of the Occupational Health Act. Now, the practicality of the question now being asked here, you're moving around to do training, if I hear the question correct. Now, in that, you're going into from one client's place or training facility to another client's training facility. It's a similarity what I did answer Yulisa now. If your staff or yourself is moving into spaces of other clients or people, you need to adhere to their policy and procedures in terms of health and safety. So you must first, before entering, forget about the screening. I'll come to the screening and the social distancing now. I'll leave that, I'll bank it now. It's first, we need to go and ask, what is your policy, client? I want to read your policy, understand it, and how to apply it. Right, that's the first thing. Then the screening one, it's a precautionary measure from yourself. We know the thermometer is a thing that you can use on and on and on and on. As long as the battery is there and it's charged, we can use it. So it's very good and helpful for you to screen everybody coming into the premises. There's no discrimination about it. I mean, it's just like a precautionary measure. The other side is then social distancing. And we've seen already on TV and that people sitting in a small place where they are distanced from each one another, at least 2 meters away. So that is the importance that you apply these principles in that place you're going in. But once again, you must familiarize yourself with the policy and procedure of the client. If there is none, you're at risk. If there's none, you're at risk, and I will advise. Step up and say, can't we advise you how to draft one or help you drafting one? That is my feeling about it. I'll be honest with you. Just to safeguard yourself.
Thank you, Charles. Anyone else with a question? Chaga.
Thank you for your name. It's Mr. Nelson. Nelson, thank you very much. We appreciate
Thank you, Nelson. Thank you, Nelson. Okay, Charles, I do have another question here from Musoke Chaga from Uganda. And his question is, how can companies manage to pay employees who have been on forced government leave of lockdown? Don't we need counselors to assist in preparing staff for better performance? I believe we have to try and cope up with the civil. Okay, so basically it's how can companies manage to pay employees who have been on forced government leave of lockdown? And the second one is, don't we need counselors to assist in preparing staff for better performance, I think, when they get back to work?
I think we do need, if I can start at the last, we do need some counselors to assist here when people coming back to the workplace, because I think it's going to be adoption of personalities and what happens to you. Why were you away from work? And again, that stigma story. It's very important to know how to deal with this whole thing. When a person returned to work after being diagnosed for the COVID-19, the health institution, like a hospital or medical practitioner, whoever treated that person, must issue, like I said earlier on, with a welcome back to work certificate, basically, if I can call it that way. To say the person is now fit to work, he's cleared with corona, and there's nothing to worry about. Because your employees might ask that, and you can say, there's it, it's clear, it's 100%. We can welcome the person back to the workplace. Because we enjoy sometimes making up a story in our heads, you know, just an assumption. An assumption is very dangerous. The other side is, you know, government places this person on. I'm not sure, Stella, is that from South Africa or another country? Because if it's South Africa, we do have the TAS, the Temporary Employment Relief System, that's available in South Africa through UIF, that they can be paid for. You know, before, I think when we started with this whole pandemic and the lockdowns, the government said, no, employers don't have to pay up front. Employers can wait for TAS to relieve their funds, and then they must pay it over to the employees. But then government also, without legislation, just urged employers, if you can pay up front, when TAS pays you, you will credit yourself with that amount of money. And from my company, we are doing a lot of payrolls for employers. So we experience this, where we pay the full salary to the employee, and then out of that, when we receive the money from TAS, because it is not tax deductible, it is not taxed. It must be just that money is the employee's money. So we then adjust the pay slip to that, so it do not affect the taxation till the end of the year. I hope that more or less put you in the right direction. Stella, you may comment on that.
Musoke, I hope that answers your question. I think the second part of his question, I think, had a lot to deal with the psychological effect of being away and the mental health of employees, and just helping them to settle back into their workplaces. And yeah, I hope that answered your question, Musoke, but do let me know if you need any more clarification on that. Other than that, I think on the chat section, we are good to go. No more questions here. Any other question from the participants? Please do let us know.
I can just maybe add on also with the psychological event that will take place when I come back to Stella, and Stella knew that I was quarantined. Obviously, it is human. Stella is going to be questioning in her mind, am I safe with Charles? Can I work with Charles? And I think that is the precautionary measures we must put in place for our employees to assure them that we're trying our best to keep the workplace clean from this virus. And like I said, there's products out there in the market, the shield, I saw Discam is using the shields. I've been to SPAR, they are using the shields that between the cashier and the client or the customer, they are at least protected there. You're paying behind the screen. If I can just maybe show you one of the things that I bought for myself, it's a shield like that. And I hope you can see it. It goes around my head like this. So I don't have to worry about a mask because the droplets will hit onto here and drop down. Remember, this thing is airborne. So we need to not spread it going out. And that's why I bought myself this one. It is me very comfortable wearing it because you do have that air coming through your face instead of a mask. Now, here is your surgical mask, and I'm using this as an example, so I don't use it daily. So, but this is the disposable one. You can use it once and must be then contaminated, and not, well, it's seen as contaminated with the virus. It must be go into medical waste disposable dustbin. And it must be treated as medical waste, not normal waste, please. Remember, your cleaner is the person that can be, it's very easy to pick up the virus. And that isn't too sure. You must start with the cleaner, not only the receptionist or the person behind the desk. Be sensible to that person that's even the cleaner. The security officer at your gate, very important. Now, this is a disposable, it's a 3-layer. It goes here and around my head, and I'll put it up there. But once it's used, gone. You can't use it twice. That's a disposable one. You do have the material mask. In South Africa, it's compulsory to issue 2 material masks. Now, I always say, 1 in the washing, 1 operational. That's why there's 2. So you must have 2 issued, and it's a responsibility from the employer either to issue these disposable masks or 2 material masks to the employee. That's compulsory. It's in legislation in South Africa. And that is all to safeguard the employee within the workplace. And also for you, going out to the supermarket, going into the mall. And, you know, I think the alert or the red zones on this stage is malls and supermarkets. If they're not properly managed, you do have difficulty of controlling that virus. Because people, when they start buying, they forget about the virus. They're into, oh, I must get bread. Oh, I must get margarine. Oh, I must get that. But we forget about the virus. We become in a comfort zone. Problematic. So, yes. If I maybe also just comment on the surgical gloves. And I've visited a couple of clients. This one here, surgical glove. They wear it, then they spray the sanitizer. The moment you add that alcohol onto that piece of rubber, thin layer of rubber on your hands, you weaken this thing. And the virus can go through it. Though you sanitize it, it's useless. So don't think you are doing a very good thing by giving your staff these gloves. You're wasting money. You're not, first of all, a medical practitioner, nor are they. You need to give a proper sanitizer that can clean their desk, that can clean their hands. That is the important. Have good soap there and it don't need to be an antibacterial soap. Normal soap and water kills the virus. Bottom line.
Thank you, Charles. Thank you everyone for your questions. Augustine from Nigeria, thank you so much for joining us. I see your question. We will definitely send you the video. It is being recorded, so do not worry about that. We'll send it to you. Musoke Chaga, once again, he is saying that CEOs are going through the hardest moment, re-strategizing for their businesses, and they are definitely going to see possible employees layoff in some companies. Musoke Chaga, Charles, for your information, he is joining us from Uganda, and they were very optimistic, definitely, and they're only getting to face the realities of the impact of COVID right now. I think we are way ahead. We've already seen a lot of companies downsizing, and I think in South Africa, we have already dealt with that. It's just an ongoing thing now. And in Uganda, they're only just starting to see that becoming a reality. So I think hence his question around that.
Yeah, you know, I think some of the companies that I think overreact by downsizing staff, because there's a lot of other remedies that you can put in place instead of downsizing your staff complement. You could do a temporary layoff and bring back your staff after this pandemic has been stabilized and being under control, instead of just retrenching. And then you get people, businesses that are bullies, that wants to show government, well, if you don't want to open our businesses, we're going to retrench. And it's so sad to hear that. And it's unfortunately, it's reality. So from downsizing, I would say, Uganda, you guys in there are suffering it now. Learn from the other countries before you saying this is now a major thing and we don't know how to deal with it. Rather connect with other countries and work together with them. And that's where the World Health Organization is coming in, is also to help with the guidance of each and every country that's affected. And I mean, everybody is affected in the world in this stage. I mean, there was Madagascar that was calling onto their remedy they do have, and they had their first patient, I think it was just before the weekend or during the weekend, that's been hospitalized and placed under quarantine. So nobody is safe, really. Like I said in the beginning also, we don't know who's this enemy. We don't know this enemy at all. It's a very silent enemy. And we need to take very much sensitive time when assessing our workplace, and again equip our employees with the right information to know what they are dealing with, and not just to make it a pandemic and then everybody is up in arms and don't know what to do. No. And I think that is the whole thing, that we took this whole time drafting a manual so that you can put your employees in a space where they are informed and they do have the information about the correct information about the virus, and then they can be conversant in talking the correct information out to other people also.
Thank you, Charles. I'm not sure if we can give it maybe a minute or two to see if there's any other questions before you close the session.
Yeah, so Asha, she also just say thank you. And apparently they do have a small bakery business in Uganda. And yeah, do the same principles there. Small basic business, you can apply it. You know what is social distancing, you know what to apply. Sanitizing is very important. Soap and water is the remedy. So yeah, we are going into winter, like I said, and I'm worried about winter time because this thing lives in coldness. The moment hot water runs over it, it kills it. But then your skin will also be burned. That I must be honest with you. So the water must be very, very hot to kill it. So sanitizing is the crucial thing, but it's only a temporary measure. After you can, once you sanitize, and the quicker you can get to a place where there's running water with, or clean water with soap, you're safe. Then you can at least wash your hands and get it off. You know, over WhatsApp, I've got plenty of friends sending me videos, sending me clips, audio clips, and that. And there was a guy talking about he was so long in health and safety, and he preaches everything of health and safety. And then he was talking about sanitizing and the components within that, the alcohol and sanitizer is based with alcohol of 75%. It's not methanol. Methanol is 100%. It is, you will find it not in a proper sanitizing material or liquid. There's the two. It's the flowing one that looks like water, and the other one is like gel. And you do have little paddies. I call it paddies. It looks like a tissue, but don't use that also. Because if the virus is on that tissue and you drop it there, remember the poor cleaner. He or she comes there with a bare hands, pick it up, contaminated with that virus. We must be sensitive when we do clean our hands, that we also think about people coming after me here. People using this. Can they use this? No, because you might be infected with the virus. That's all the questions. So you must be really open-minded when you go and start asking questions where to safeguard what. Is there any further questions so far? I see one message. You've got it, okay. Good for that. Participants, each and every one of you are welcome to email Stella or myself. If you don't have now questions, I tell you, I will answer you, and Stella will also guide and help you and answer you. So don't worry. It's not the end of the session. There is a lifeline thereafter also.
Thank you, Charles. Chagam Soke, again, he's just reiterating the use of disinfectants. I think that is in keeping the office environment, the workplace disinfected at all times. Yeah, Charles, you want to shed more light on that?
Sure. Paper towels, number one. Number two, sanitizer. We clean our desk before we start, your computer, your keyboard. You know where's the most dangerous thing onto a person? A lady's in her handbag, in my car, which I'm driving with. On my side, I put my what there? My wallet. My wallet is full of germs, let me tell you. Remember how many times you use cards. It's a loyalty card, it's a credit card, it's a cash card, and it goes from machine to machine. We don't have control over that. Remember that. That's your worst enemy. So clean that, sanitize that also. So at least you know when you go out there, your purse is chippy clean. Cleaning your desk. It's the place you are working on, your computer screen, your keyboard. And just by wiping it with a cloth that you sprayed your sanitizer on and wipe it off, that's fine. It minimizes the risk. And I think that is what we're trying to do.
Okay. Well, I think that's all from the questions from the panel. Thank you, everyone, for joining us. I think some of our guests have already left. We still have quite a number here. Thank you, everyone. Just to reiterate that we will send you the resource pack, and I will also send you the recording as soon as it's available. As soon as it's available, I will have it sent to you. Just ensure that I do have your email address. Most of you here have already registered, so I do have your contact details, but if anyone here, like Lizzie, don't think I have your details. If there's anyone here who did not register with me, please do send me your email address so that I could send you the resource packs and also the recording of the session. Otherwise, from me, thank you very much for adhering to our call. I hope that we have all been informed and we have picked a lesson, one or two, that we could go back and implement in our workplaces, especially employers and people in the human resource positions. It's very critical information that we have to comply with. So from my end, thank you, and do have a wonderful day further. Charles, kindly just close the sessions for us.
Thank you very much, Stella. Thank you, Stella, for your organization and also for managing this whole project. I must be honest, I'm delighted to see so many people across Africa that was joining us. And thank you very much for the interesting questions asked. You know, any question, it's not a stupid question. It's a question.
Just to highlight, Charles, that you said from Africa, we had James from Kenya, we have Angola, we had Uganda, we have Nigeria, and then of course South Africa, and we had Zambia in the house as well, and Lesotho. So yes, that awesome. Was quite impressive. Thank you.
Awesome, I love it, I love it, yes. And we're looking forward to seeing you guys next time again. Thank you very much. Take care, be safe, look well after yourself, your family, your friends, and your colleagues, and your employees. God bless.
Wash your hands.
And wash your hands. Sanitize.
Thank you. Yeah. Yes, about it.
Thank you, guys. Take care.
Thank you, Chada, for joining us.